I'm Marc Weill, and I have a practice in natural medicine for about 40 years up in San Francisco. And this is my first time down in LA to get to meet you people and work with you. I've worked with people in Seattle, New York, San Francisco, so now I get to come to LA. What I'm going to be teaching you is really easy for all of you with your backgrounds to learn. We're going to be working with how to get immediate results, because I find that in my practice and in most people's practices, if we don't get people to have a change almost immediately, we can't get them to do the long-term steps. You know, all of us want to have their diet changed, we want their behaviors to change, we want them to exercise appropriately, but I always say that it's a little bit like pulling the thorn out of the paw of the lion. They come in and they're in pain. They come in and they have something that's not working, and they don't want to say, they don't want me to say, you're going to spend 6 to 8 weeks eating a different diet and you're going to slowly detox and maybe your pain will go down. I have to produce a result really quickly, and since a lot of you are the kind of practitioners, whether it's chiropractors or whatever, where you've got about 15 minutes to figure out what's going on and to get something done that's going to give them a result. So a lot of what we're going to focus on today, there's other things I can teach, but we're going to focus on how to get really quick results with everybody. And if you can demonstrate results in your practice in the room and they have relief, they will start to listen to the rest of what you say. And that's really what's happened for me, is that when I can give somebody, Stephanie mentioned earlier that's not on the video, that she saw me demonstrate with a person that I know that's, you know, she's in her 50s and had a back pain, and literally I gave her one remedy and she suddenly went over and had about a 75% increase in forward flexion when she had broken her back from a horse riding accident. When you can do that with someone, people then start to listen to the rest of what you have to say. So that's a lot of what I like to focus on. It doesn't mean I don't believe in the long-term care, because I do. And those of you that know me will know that I'm going to be about changing your diet, about making your behaviors right, keeping your mind working really well, having a lot of joy, having a lot of fun, because all those things matter. But today we're teaching how to manage pain and how to get rid of it, or really reduce the symptoms, increase the range of motion very quickly. That's really the goal. Now, my experience is also that about 80% of the people that I see, I can get well pretty quick. They're the easy ones. But my practice is basically turned into the 20%. So when I've done the AK training and they talk about the 80-20 rule, you know, you get about 80% of the people well, the other 20% are sort of difficult and you maybe don't want to deal with them. Well, I'm getting the 20% mostly. And that means that everybody else has filtered everything else out for me. They've had MRIs, CTs, X-rays. I've worked with some of the men from the St. Mary's men's basketball team. That's perfect, because trust me, they have money and they can get all the X-rays, all the CTs, they can do all that stuff. So when you work with a college basketball team, they're orthopedists and everyone's checked everything out. So when a center can't do a hook and everybody's worked on him and the PTs and the chiropractors worked on him, and I come along and I do a little 2-minute thing and suddenly he's doing this and he's like, because the good news is they didn't break anything, they didn't rupture anything, they didn't tear anything, they didn't herniate anything. So I'm not worried. Now I know there's something else that people need to deal with. And that's really what I'm going to be teaching, is the something else. So I'm not saying don't do those modalities. You need all that information. But when you think about the 20% that come in, and I'm going to be talking somewhat to physical therapists, chiropractors, massage therapists in this part, not that acupuncturists don't get this, but sometimes we've worked on people really to change something, right? And they've got a pain. And it comes and it goes, and it comes and it goes, and it's like we sort of get some results, but then they go away. And we're like, what did I miss? And that's what got me started in thinking about this. So I started to think, what am I missing? And when I started to look at, because of a number of things in my life, I started to look at a new way of seeing it. I started to look at the lymph system. Now, I'm standing on the shoulders of a lot of people here. I didn't invent any of this. I did TBM, I did AK, I did the AK training 4 years in a row because I feel like I'm sort of slow, and I am. I have to repeat things over and over and over again. But once I repeat it till I feel like I could teach it almost, and that's the way I do it. I have to repeat things. You know, and I've spent time with I didn't do the chiropractic neurology training, but I also did their biochemistry portion. That's where I met Will and Teresa, and I loved their point of view. And I've done a bunch of other trainings with lots of other people. And what I did is I started to put it together, because that's really where my brain works. I work in sort of taking a different point of view and spinning it and looking at it from another way. And so the overview of what I'm going to be teaching you is how to proprioceptively challenge the body. Because in AK they have their challenges, in TBM they have their challenges, in chironeuro they have their challenges. I've just looked at it and said, you know what? When we got a person standing here and they're doing pretty good, or we get them off the table and they're doing really well, you know, in AK they might have you run in place, they might do a stress tap of 10 times, but when they go out in their life and they don't last for more than a day, a week, or whatever, then we missed something in the room. So my whole focus is, how do I challenge them in such a way that when I test them, they tested good, but I know they're going to go out there and they're going to call me up 3 days later and say, my kid, I picked it up her out of the car, and then my back, and I'm like, okay, I need to be more effective to find those things that are buried, that are deeper, that I was missing. And as I looked at that, and I looked at all the different ways of challenging, I started to think about something a little different. And this is what I'm going to teach you. To me, the lymph system is really one of the keys to the whole way of changing the body. And especially with pain, with a whole lot of other issues too. Because, give you a point of view, and this is not the truth, but it's as much of the truth that I can give you. When you have a pain that's a 10, 24 hours a day, 7 days a week, you go get an MRI, CT, or an X-ray, and I don't want to see you. If that pain doesn't change, I don't want to see you. Why? Because there might be something really serious and you need to have that checked out. If your pain can go from a 1 to an 8, a 10 to a 4, if it can fluctuate rapidly or with the right treatment, then something else is going on. Now, that doesn't mean you don't get the MRIs, CTs, X-rays, you do all that stuff. But we're talking to an audience where people have done most of those things. And what I started to think about, and this is what made me sort of change the way I was working, was people would have pains that would fluctuate. How many of you here have a pain that is still there even when you get treated, but it comes and goes? Anybody? Okay. How many of you have that pain fluctuate? Everybody? Great. Let's think about our patients. How many of them we have where their pain has some gradation of change? Most of them? Especially, and the ones that never change, those need we need a different approach. So I started thinking about this, and this is going to contradict some of what people like, but I started thinking, well, that most of my patients that are having difficulty, they know when a chemical, people are always saying, well, you know, it could be chemical toxicity, it could be the mercury in their fillings, it could be any number of things that they're talking about chemicals. And I go, well, all of my patients that I'm dealing with that have problems have paid attention to that. How do I know? They know when they use bleach, when they're around cleaning products, when they go into Macy's near the perfume counter. They know all of those things will aggravate them, and they stay away from those things, mostly. You know, occasionally they get surprised. They walk in a candle shop and, well, they got to leave. So the thing that seems to change for most people when it's pain, yes, stress goes up and down, but what happens when stress goes up and down? Our chemistry changes, and usually the thing that will bloom or grow is a pathogen, because chemicals don't grow, right? I got exposed to chemicals in the nail salon shop, and suddenly 3 weeks later they grew. I don't think so, right? You know, and I did use bleach last week, but maybe the bleach sort of multiplied in my body. It doesn't do that. So when you have things that are coming up and down, 99% of the time, yes, you have emotions that could be setting your immune system down, but what seems to multiply? A virus, a bacteria, a fungus, mold, or a parasite. That's about it. Yes, there's psychic and emotional issues. Those things need to be dealt with, and that's not what I'm good at, and I'm not addressing that. But really, stress goes up, our immune system goes down. We have sugar, our immune system goes down. We're around EMFs, our immune system goes down. You know, we're in a near car accident, which is another form of stress, our immune system goes down. When our immune systems take a dive, the pathogens say it's time to party. That's really what it is, right? You know, I helped raise a couple of kids with my ex-wife, and the kids nowadays, they have cell phones. And when parents leave, everybody sends each other a text and says, Mark's house is empty. I came home one night and there were like 50 kids there. Do you know that there's something called quorum sensing? We will show you a video of that. Any of you know quorum sensing, Bonnie Brassler's video on TED Talk? We'll show you. There's a thing that goes on. They know this happens with bacteria, and it's a beautiful video to see it, but I want you to understand. We all know what a quorum is. When you get enough people together, you can vote and you can do all that. Well, bacteria have a way where they send out a little chemical signal to each other. And it's sort of, think of it like radar. And they're sending out a signal, and then they get a bounce back from one of their friends, because they're sending out signals. And then they're all bouncing back. And when they get to a certain critical mass, they upregulate their lethal quality. So there you've got 3,000 bacteria amassing on your fingertip. They're all just hanging out, partying, right? Like, we're waiting for the rest of the people to come. And they come, and finally you got a couple 100,000, and then they change their chemistry once they get enough signals, and now they go virulent. So that's why you could, maybe I have a sore throat, I don't know. I'm a little off, and I'm feeling a little funny. And then you wake up the next morning, and it's like full blown. You can't swallow, right? Now, they've perfectly analyzed and know that quorum sensing exists with bacteria. Nobody's been able to prove that with viruses, but my experience is it's the same thing. That's my experience. I can't prove it scientifically, but clearly, we'll show the TED Talk. We know this happens with bacteria. So they're at a certain level, their variance factor upregulates, and that's why your patient will say, that's sort of on the edge, but now, man, I feel like it went crazy. Well, what'd you do? See, this is where I say to people, everything affects everything. And then when they get confused, I say, everything affects everything. And they're like, well, you mean everything. And it's like, yeah, whether you slept, what you ate, what you didn't eat, how long you went between the meals, the kind of stress you were under, I got too hot, I got too cold. Everything affects everything. I went into a moldy house, but I was only there for 5 minutes. But I was tired, I hadn't eaten well, I've been dealing with sick kids, and next thing I knew, it went from a little to a lot, right? Now here's another piece that I think is really sort of helpful, and most of you will have seen people like this. Have you ever had anyone that says, I have a recurrent thing? I have lots of people that have recurrent things, right? Bladder infections, yeast infections, sore throats, otitis media, right? Sinus infections. What does recurrent mean? It never went away, right? You have the person, they had the flu, they were better for 3 weeks, and then it came back. Where'd it come from? Was it sitting next door? Oh, it was in their body, right? I forgot about that. It was in their body, and then they weakened their system, and it came back harder and faster, right? So a lot of times when we're checking people, if we don't find a way to proprioceptively challenge them, they look and test good. They're not, but they look and test good. And then 3 weeks later, it comes back and really takes them down. So I start looking at, when I'm assessing people, I want to know about all their past infections, all their past problems. Have you ever had more than one bladder infection, more than one UTI, more than one sinus infection, more than one sore throat? Oh yeah, and it's always on this side. I had a woman who had so many bladder infections, she wouldn't know she had one. She had lost her sensation down there. She wouldn't know she had one until she was peeing red. She would have like 10 to 15 a year, and after a few years, it was like, that's how bad it was. I have an ER doctor. She was trained in Germany, and I fixed one of her friends who had really frequent bladder infections. And she came to me and she said, I see this in the ER all the time. She said, more women come in for recurrent bladder infections than any other single thing. And I said to her, this is what I found when I tested. I said, they're MRSAs. They're antibiotic-resistant strains. And she was like, no, that's impossible. And I said, well, let's do an NIH search. Well, you can do those searches. And guess what? They're now culturing these things and finding out that from all the... So you're a woman, you've had 4 or 5 bladder infections, you keep taking antibiotics. 2, 3 years later, you do it again and again. And now what you've cultured in yourself is an antibiotic-resistant strain. And yes, think of it this way. We're in football season, so I'm talking to people that may view this later. I always say it's like this, I've got the ball, I'm running towards the goal line, and the punt returner grabs a hold of my jersey and slows me down a little, right? And now the big guys come along and jump on me. So when somebody gets a little thing, they get a little virus, they get a little something that they could sort of fight, but it slows down their immune system. The white cells are sort of diverted. Now, the bladder infection that's been sitting in the background just full force hits them, right? So Yes, there's more than one vector. It's not just a virus, it's not just a bacteria, it's not just a parasite, it's not just fungus and mold. It's multiple vectors. But you need to be able to test that, find which ones are there, and find what will really support the body to turn this around. So all of you are now probably thinking about all those people with recurrent things, right? And they're the ones, I'm talking to the chiropractors and I'm also talking to the massage therapists. Here's the thing that I've noticed. If you have to adjust or move something on them more than once, and it keeps needing to be moved all the time, I would be checking, I'm going to the lymph system now, I'd be checking the lymph glands proximal to that area that you keep adjusting. And that's partially where I've gone. And my point of view is real simple. We're going to talk to the audience out there as well as you so you learn this. If there's 600 to 900 lymph glands throughout the body, they're little pumping stations, you know, they do their little phagocytosis. They eat up the bad guys, and it's the sewer. But remember, there's lymph vessels running everywhere. So what I have to say to patients is really simple. How do you know where your lymph system is? Have you ever had a cold, a flu, a hangover, or a food poisoning? And you ached in every joint in your body, right? Oh, I've ached everywhere. I've even ached in my earlobes. You ever squeeze this? Yeah, I got a little nodule in there. You ever notice that? God, it's weird. It's like bumpy, right? Now, everybody knows lymph nodes here. They know them here. They know them here. They forget they're everywhere. They live along every vertebrae. They live along every joint. So when you have the food poisoning, the flu, the cold that ends all colds, you ache everywhere. Those are all your pumping stations that are swelling, and they swell to sometimes 6 to 8 times their size. And when they swell, they put pressure on the joints, they cause acute pain, and obviously they can make you sick. Now here's the other piece. My cats are better detectives and smarter than most people because they know that standing water breeds bacteria, and they haven't had any kind of biochemistry class. So if you put a bowl of water out there, the next day they're looking at it, and they follow me upstairs, and they go to the bathroom, and they get in the tub. And they sit there like, are you going to run some fresh water? Like, yeah, all right. I get on my knees, I run some fresh water. And my cats drink the fresh water, and then they leave. And I have to pull the plug out, rinse the tub. And then next time they see me, they're doing the same thing. It's like, unless the water is fresh, you ever notice the biofilm that forms on water when it sits? They know that isn't good. Now, they'll eat mice. They'll eat gophers. They'll eat anything that moves that's small enough for them to get. But they won't drink water that's sat there for a day. They won't, which is crazy. But our lymph, when we get a little swelling, oh, by the way, we're sort of warm and moist, right? That's sort of almost a perfect environment for virus, bacteria, fungus, mold, parasite. So we're warm and moist, and we get a little swelling here. It's standing fluid. It's the perfect breeding ground for anything, anything. And I'm going to show you how to find those areas in people so that the hidden ones, the obvious ones show up. Yeah, I get it here, I get it here. Start palpating their spine. Start palpating the medial aspect of their arm, the medial aspect of their leg. The easy one is you start palpating medial aspect of thigh down to the knee. Do it on yourself. How many of you have, I've got a nice spot right here. This one is nasty. It's not just painful, it's like, ow, hurts, right? I can go above it. It's a little uncomfortable. I go to this one, and it is fire. Any of you have that? You can find them? And maybe you can find it in here. You come down the medial aspect, and you'll find a couple tender points. I'm not talking about axilla. I'm talking about follow the lymph channels, and you'll find someplace where it's stuck. And if you think about it, or if you have lipomas are lymph, right? So let's explain lymph to you in a different way. We all know what blood is. And we all know what cerebral spinal fluid is, and I've never seen it except in videos. And you probably will never see that, right? And if you see your own, you're probably going to die. So anything that doesn't look like blood is lymph. Tears, snot, water coming out your ears, sweat, coughing stuff up, all that is lymph, right? It's the sewer. Mostly it's clear. We all know when it gets to be yellow or green, that's a really bad thing, right? We know that. Yeah?
Excuse me, how is a lipoma, which is a fatty nodule, how do you see that as lymph?
what will happen is, that's a great question. Why would a fatty nodule be lymph? All the waste in the body, we'll have the easy answer to that one. When we were youngsters, when we were teenagers, I would have a pimple and I would squeeze it and out would come a milky white fluid, right? And then you would have a pimple and you would squeeze it and it would never pop. Maybe you get a blackhead and that would come out. But then you have the one that's cystic, which I used to have cystic acne when I was young. You don't squeeze those. You squeeze one of those one time and it's like the pain is what they call exquisite. It's not exquisite, it's just horrible, right? So you think about it, cysts, lipomas, cancer, the sewer is going to get rid of stuff if we can thin it out. So it's various levels of viscosity. And if it's easy to get out, like tears move easily, urine moves easily, sweat moves easily, all that lymph is diluted down and it's less viscous. But when it sits for a long period of time, it starts to change in its constituency. It becomes a breeding ground for a lot of things, and everything will aggregate there. Then you might get chemicals there. Then if you're exposed to other things, they will tend to get caught in the eddy into the pooling effect wherever that is. And so I found that when people have lipomas, there's many ways we'll talk about how to work with all these, but if you check around the lipoma, you're going to find, maybe you'll find something there, and you'll find if you know how to do lymph drainage or use some other tools like lasers, you can actually drain those areas. And we've done that repeatedly with people that we've had people with breast lumps that could be, we don't diagnose, but somebody might say they're cancer. And when we clear the lymph system proximal to that, those things go down. I can tell one story that is, since I can't treat people for cancer, but my ex-wife, when we were married, she had a bad lump. We live in Marin County. Marin County has the highest rate of breast cancer in the entire United States. We found a lump. She did a mammogram, and the mammogram looked bad. At the time, this is what got me into doing some of this stuff in a different way. Someone turned me on to thermography. We went over to a man that made thermographic cameras, who also made a laser. He did a therm, and we could see what I now know, because I have thermographic cameras. We now could see angiogenesis, blood forming, pooling to feed this tumor. He said, and he's not a doctor, he said, well, if you want to use a laser on this particular spot in the back and have her sit in front of the therm, you can watch whether or not you've got the right spot, because if you've got the right spot, we found a spot on her back that corresponded through some other means, and we had the laser on her and we had her sitting in front of the streaming therm, and we watched the angiogenesis cut down. We treated her 3 times. We had a biopsy scheduled. We treated her once a week for about an hour 3 times. Went to the biopsy. The oncologist was very upset because she had scheduled the time. She came in and palpated it and said, well, it's obviously a cyst. It's not there. Like, why'd you waste my time booking an appointment? And it's like, well, we wanted to make sure. So we knew that with the thermography showing us that the angiogenesis cut down, and that was a very defined pattern, we knew that we had broken up whatever was there and excreted it. We also made sure she was drinking a lot of liquids, she was doing enemas, she was eating a good diet. So it wasn't just with the laser. But the point is that the lymph can go from, you can have a benign lump and it can go malignant. You can have a sort of sore throat, and I've had one girl who her throat closes up to the point that they're worried about her and they have to give her steroids. So lymph fluid that's sitting and static can literally change in consistency and grow something like that. I see some people nodding. That's consistent with what you know, right? So here's the other thing about lymph that I like. We don't need to just test at the lymph glands, and this is what I'm going to show you. If we can test along the lymph vessels. So think of it this way. You got the shoulder bag, and after a while your shoulder starts to hurt. Or I have the women that have very large breasts and they come in and you see these grooves in here. I'm talking about grooves where the clavicles are actually dented. Or you see the guys where they're wearing the size 34 belt and they should really be wearing a 46. And I'm in the gym. And you see the groove down here. Well, lymph can't move when there's compression, right? So don't think just about the lymph glands. Think about all the places. It's like, ever since I leaned on my arm when I was doing that thing and I was in bed, everything's all weird in here and I've got sort of a frozen shoulder. Well, if you compress lymph with bras, belts, behavior, repetitive behavior, you're going to think of it as a vessel. And that's why I think of it as, this is the easy way for people to get it, is that it's the U-joint under the sink. You know, the little P-trap. And if you compress something long enough with whatever your behavior is, you will actually damage or compress or limit the flow of lymph through an area. And it may not be at a lymph gland. It may just be because you're wearing, I encourage people not to wear really tight things. I encourage people not to tie things as tight as they want to tie them. I mean, I don't want them walking around in shoes that they're kicking on and kicking off, because I want some stability, but I also want them to have room to move. Yeah, well.
There's a lot of orthopedic shirts, very tight, binding to postural change type shirts. What's your opinion on that?
It seems to compress lymph really badly. And I don't like any of those things. Well, it depends. If somebody doesn't have a problem, but I'm assuming the reason people wear those kinds of things is because they have a problem, my back, some part of my body isn't stable. That's different than people that say, well, gee, I'm a little overweight and I want to sort of press everything in so I look good for my outfit. And you're not doing, hopefully you're only doing that for a night, right? If you're doing that every day, that might be a problem. But if they're doing an orthopedic device, then there's a problem. And I've worked on some basketball players and I've worked on people that wear splints and braces. And clearly, we're talking about things that are also not just, many of these things are not what people call lymphedema. I mean, that's the obvious one. That's where it's gone out of control. So I'm saying long before it's edema and you can see it, swollen arm, swollen leg, whatever, there's a lot of other gradations between, it's like the pimple. White, you pop it, cystic, you don't. Don't ask a woman if you can ever try and pop a breast cyst, she's going to hit you, right? So it's like, you're not popping any cysts and you're not popping any lipomas. So the more viscous it gets, then you have to find a method, and that's a lot of what I'm going to be teaching you, about how to break that up, how to get in there. And that's, you know, you have lots of choices, and that's why I'm going to be teaching this. Now the other thing about, and this is a good question because it made me think about something I wanted to say about lymph. Anything that people are wearing that compresses them is bad, anything behavior, you know, people falling asleep in chairs at weird angles, all those things, you know, they keep getting, you know, especially if the only way, some people have back problems and the only way they can sleep is in sort of a weird chair. You start checking all the lymph proximal to which, show me how you sleep. You know, try and position your table or a chair in the office. And sometimes people will say, you know, I'm really bad when I get up in the morning, but if I walk around for a good hour or so, it seems to get better. They're pumping their lymph, right? So now it's 3 o'clock and they're in your office and they're like, well, I was sort of bad this morning, but I'm doing pretty good. It's like, let's put you in the position that you slept in. Oh, I only sleep on this side. How many people, I have a lot of people only sleep on one side. And I'm like, can you sleep on both? No, I can't, because if I sleep on that other side, that arm, it's not right. There's something wrong, and I can't sleep on my back. And so they know that they have compression, right? I mean, it's pretty obvious. The other piece about this that I think is really important is, how do you start to correct this? And this is an important piece. Remember, the heart, we know what it does. What is the system for pumping the lymph? Movement. It's the only thing that does it, right? Now, the 80% of the lymph pump is the front toe hinge. 80% comes from this mechanical pumping when you walk and you step up on your front toe hinge and moving the rest of your body. So all of you that are chiropractors know the cross-crawl motion. You know, when you're cross-crawling, you're actually getting the spine working, and when you're getting the spine working, you're resetting the nervous system, and you're also pumping lymph, right? So a lot of times I tell people, you first look at their shoes, obviously, and if their shoes aren't flexible, they're not pumping. Now I know I've worked with people who live in Hawaii, and all they do is wear a slipper. That's all they call it. It's not even two, they call it slipper. I'm like, do you wear only one? But the reality is those people are pumping all the time because their feet are moving, right? And then if you're walking on sand, they're moving. But a lot of people wear shoes that are really thick, their soles don't bend, or they have injuries to their feet or their ankles and they don't flex, right? So here you have people with lymph stasis. Again, we're not talking lymphedema. Those are a whole nother set, and they need more, they need a different kind of care. And it's not that I can't give them some good things out of this, but they may need additional care beyond that. But when people are moving, and they're moving well, they're pumping their lymph. That's why I'm going to always tell people, you need to be active. Runners, if you do things correctly, wearing good shoes, all that, runners tend to move their lymph more. Swimmers tend to move their lymph more. Swimming, obviously, you're using everything and it's moving throughout the whole body. When you dance, when you do Pilates, when you do yoga, it all again, effective dance, effective with anything. So I'm going to say, because I've seen people that do things incorrectly. But when you do it effectively, you start to move this. That's why generally people that are effectively active tend to get sick less. When they get sedentary, they tend to get sick more. So again, the pooling fluid becomes the breeding ground for any of the problems. Is there a question? Let's see. No? Okay. One other part about lymph that I like, and I've spent some time studying, I've taken trainings with other people, and lymph to me is the drainage for the whole body. That's really what it is. It's drainage for all the waste. And so I was studying with Gary Klepper and Rain Crow, who are two of my favorite people that teach homeopathy, and I studied with them for years, and they gave us, quote unquote, the watchwords for alternative health, which is drainage, drainage, drainage. Unlike real estate, which is location, location, location. Well, I took drainage, 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 and I went, if I'm going to test lymph, it is location, location, location. I look for the locations in the body that where the problems are, right? And the patients give it to us 99% of the time. They give it to me. I ask them, where do they hurt? Where do they have a problem? What reoccurs? Well, it's not here now, but I always get that thing behind my knee. I've had a Baker's cyst back there, Another lymph congestion, right? Because you have the sewer. And I get those lumps behind my ear. All the lymph comes up the front, up the back, turns and goes down, right? 75 to 90% of the lymph occurs, the drainage occurs in here. About 25% on this side. There are people that are anomalous, and they have it switched to the other side. But you can figure that most of the people have it somewhere in this juncture. 75 to 90%. So if you're having trouble finding it, then you might palpate somewhere along here. It may be blocked somewhere else, but you can try and palpate this entire quadrant, and there may be intercostal spaces, rib heads, where there's a lot of congestion, because if that's where all the traffic is coming to, and you happen to have some thick viscous lymph, it could get stuck somewhere around there. It may be the occipital headache that they get. It may be the thing by their eye. It will be wherever it will be, but they will know and they will tell you exactly where they hurt. Are you familiar with people coming in and saying, I got this thing here, they did an MRI, they did all this stuff, there's nothing there. What happens when you push on it? Well, sometimes, it just feels good to push on it. And people know, right? So that's a place you're going to be testing. That's why you don't have to, you can ask questions in all systems, but I start with the patient, because the patient is going to tell me, are there any places where, sometimes I just do this and it feels better. Well, in 2012, they actually confirmed that there's lymphatics in our skull. It's amazing. They finally confirmed that. So there's many kinds of lymph, and sometimes you have to test really superficial, and sometimes you test deep. And so you're going to ask people about their history, and that's going to help you. And if you suspect an area is off and you're testing superficial and you can't find it, go, change your angle. So a key, and I'm going to teach this in a minute, change your vector. I have a chiropractor friend who's really amazing at AK, and when she's testing me to adjust me, she's checking, she won't just check lateral, superior, inferior. She'll go around the clock and get the exact angle. She'll be muscle testing me, and it'll be like boom, 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 boom. And she gets the exact angle, and when she hits that right, then the adjustment is smooth and simple, and it's perfect. And I used her proprioceptive challenges to think about lymph, because if I know I've got something around here, it's like slightly painful, and I check it at that angle and it's not working, I'll change angles, I'll change vectors. And when you think about lymph vessels and these little valves that are in here, so you got a vessel with a valve, these vessels are one-way valves, right? They get pressure and they move. If you have a vessel here with a line, with part of the valve on the outside, and you've got a little gunk sitting right here on either side, the valve won't open. It won't, and it won't move through there. So it's like the door where you stick the pencil in the door and the door won't open, right? So a lot of times you're ending up checking the wrong place, because people will tell you, I know it's here. change your angle, change the vector. And then suddenly it'll be like the muscle test will be strong and you'll go, damn, I knew it was there. I just was doing the wrong vector on it. And likewise, then if you're treating, there's lots of ways to treat, then you might have to change. In lymph drainage, they will do a backflow sometimes. They'll go backwards to change something, to take it out, and then they'll move forward. And I'll use lasers and I'll use it on those areas. And again, it's the vector that has a lot to do with it. So yes, all the different kinds of lymph matter.